There is a number that has been drilled into the minds of almost every adult in the modern world. You have heard it your entire life. You have seen it on posters in doctors' waiting rooms. You have been told by well meaning physicians, nurses, and health articles that this number is the gold standard of cardiovascular health. That number is 120 over 80. And for decades, the medical world treated it as the universal target, the proof that your heart and blood vessels were doing exactly what they should be doing. But something remarkable and deeply important has emerged from the research on older adults specifically, and it challenges everything most people over 60 have been told about what their blood pressure should be. The truth is more nuanced, more personal, and in some cases, more urgent than any simple number can capture. A large research study followed more than 15,000 adults who were 75 years of age and older. They tracked these people for 5 full years, monitoring their health outcomes, their hospitalizations, their mortality rates, and their rates of serious falls and injuries. The researchers grouped participants by their systolic blood pressure levels, which is the top number in a blood pressure reading. They looked at groups with pressure below 120, between 120 and 130, between 130 and 140, between 140 and 150, and above 150. What they expected to find was what most people would expect. Lower blood pressure means better health outcomes. That is the conventional assumption that has guided medical treatment for generations. It is the assumption your doctor likely operates from. It is the assumption printed in nearly every mainstream health publication available today. What they actually found was something that every adult over 60 and every family member caring for an older loved one needs to understand. The group with the lowest mortality rate, meaning the group that was living longest and experiencing the fewest serious health events, was not the group with the lowest blood pressure. It was the group with systolic pressure between 130 and 140. The people who had been successfully medicated down to below 120 systolic, those with what appeared to be the most ideal blood pressure numbers, had a 28% higher risk of serious falls. They also had higher mortality rates than those whose pressure sat at a moderately higher level. The blood pressure that looked best on paper was, for many of these seniors, quietly making their lives more dangerous. This was not a small or insignificant study. This was 15,000 people tracked over 5 years, and the pattern was clear and consistent throughout. To understand why this happens, you have to understand that blood pressure does not behave the same way in a 70-year-old body as it does in a 40-year-old body. The physiology of aging changes the rules in three very specific and important ways, and most standard blood pressure guidelines were not originally designed with these changes fully accounted for. Once you understand these three changes, the research findings stop being surprising and start making complete sense. They stop feeling like a contradiction and start feeling like the logical result of applying young body medicine to older body physiology. The first change involves your arteries. Over the course of a lifetime, arteries gradually become stiffer. The walls of young arteries are flexible and elastic. They expand slightly when the heart pumps blood through them and then recoil, helping to maintain smooth, consistent blood flow throughout the body. As the decades pass, this elasticity diminishes. The arterial walls become less supple, less able to flex and absorb the force of each heartbeat. Stiffer arteries do not move blood as efficiently as flexible ones. And because of this reduced efficiency, the body actually requires slightly higher pressure to push blood effectively through those stiffer vessels and ensure that vital organs, particularly the brain and the heart, receive adequate blood flow. In other words, the same pressure that was perfectly appropriate for your 40-year-old arteries may genuinely be insufficient for your 75-year-old arteries to do the same job. This is not a malfunction of aging, it is an adaptation. The body is compensating for structural changes in its blood vessels by running at a slightly higher pressure. Forcing that pressure back down to younger adult levels can interfere with that compensation in ways that create real consequences The second change involves tiny pressure sensors in your blood vessels called baroreceptors. These sensors continuously monitor blood pressure and send signals to your brain and cardiovascular system to make adjustments. When you stand up from a sitting or lying position, gravity pulls blood downward into your legs. A healthy circulatory system responds to this within seconds by slightly increasing heart rate and constricting blood vessels to compensate, keeping your blood pressure stable as you rise. In younger adults, this compensatory response happens quickly and automatically. You stand up and feel nothing unusual because your body has already adjusted before you even registered the change. But with age, baroreceptor sensitivity decreases. The sensors become slower to detect the shift. The signals take longer to travel and generate a response. There is a lag between the moment you stand and the moment your body fully compensates for the gravitational shift in blood distribution. During that lag, blood pressure in your upper body can drop significantly. And if your resting blood pressure has been medicated down to a low baseline, even a moderate drop during that lag can bring your pressure to a level where your brain is not receiving adequate blood flow. The third change involves how your body processes medications. Your kidneys and liver are the primary organs responsible for clearing medications from your system. With age, both of these organs work more slowly than they did in youth. A standard dose of blood pressure medication prescribed based on guidelines developed largely from studies of middle-aged adults may remain active in the body of a 75-year-old for significantly longer than intended. The medication that is supposed to lower your blood pressure to a target range may, in an older body, push it lower than intended and keep it there longer than planned. What appears to be a carefully calibrated dose on paper may actually be functioning as an overdose in the context of an aging system that cannot clear it at the same pace. This is not a flaw in the medication. It is a consequence of applying standardized dosing to a body whose processing capacity has changed with age. Now bring all three of these changes together. You have an older adult with stiffer arteries that need moderately higher pressure to function well. You have slowed baroreceptor responses that create dangerous windows of low pressure every time the person stands up or moves. And you have slower medication processing that makes standard doses more powerful and longer lasting than intended. When you then aggressively lower that person's blood pressure to match guidelines designed for younger populations, you are working against the physiology of their age, not with it. The well-intentioned treatment becomes its own category of risk. Picture this scenario because it plays out in clinics every single day across the world. An older adult comes in for a routine checkup. Their blood pressure is measured while they are sitting calmly in a chair after resting. The reading is 145/86. The doctor consults current guidelines, which recommend bringing systolic pressure below 130. A medication is prescribed or an existing dose is increased. A few weeks later, the patient returns. Their sitting blood pressure is now 122/78. The doctor is satisfied. The numbers are where guidelines say they should be. The appointment ends with a sense of success on both sides of the examination table. But what the clinic visit did not capture is what happens to that person's blood pressure when they get up from their chair at home, or when they get out of bed in the middle of the night to use the bathroom, or when they stand up too quickly after sitting for an extended period watching television. In those moments, with their resting pressure already medicated to a low baseline and their baroreceptor response too slow to compensate quickly, their pressure may drop sharply and suddenly. A sitting pressure of 122/78 can become a standing pressure of 88/56 within moments of rising. At 88/56, blood flow to the brain is critically reduced. The room spins, the legs feel suddenly weak and unreliable. Vision may dim at the edges, and then the fall happens. Falls in adults over 70 are not minor events that can be brushed off. A fall at this age can mean a hip fracture. A hip fracture can mean emergency surgery. Surgery at 75 or 80 carries serious risks, including complications from anesthesia, infection, blood clots, and prolonged immobility. And the recovery, if it happens fully at all, can involve months of rehabilitation, loss of confidence in moving independently, and in many cases, a permanent reduction in the mobility and independence that defined that person's daily life before the fall. All of this can begin with a blood pressure number that looked perfect on a clinic chart. There is a test that can reveal whether this dangerous pattern is happening in your body right now, and it requires nothing more than a home blood pressure cuff and a few minutes of your time. It is called an orthostatic blood pressure measurement, and it is one of the most informative and underused tests an older adult can perform. The process is straightforward. You lie down completely and rest for 5 full minutes, not 3 minutes, not approximately five, a full 5 minutes of stillness, allowing your cardiovascular system to fully settle. After those 5 minutes, you take your blood pressure while still lying down and record that number carefully. Then you stand up and take your blood pressure again immediately within 1 minute of standing. You are looking at the difference between those two readings. If your systolic pressure, the top number, drops by more than 20 points when you move from lying to standing, that is a clinically significant warning sign that deserves immediate attention and discussion with your doctor. If your diastolic pressure, the bottom number, drops by more than 10 points, that is equally concerning. This pattern is called orthostatic hypotension, and it indicates that your circulatory system is not compensating quickly enough when you change positions. If you also experience any dizziness, lightheadedness, visual dimming, or physical unsteadiness when you stand up, those symptoms are confirming what the numbers suggest. Your blood pressure is dropping too far when your body moves through the ordinary positions of daily life, and that drop represents a direct and measurable fall risk that needs to be addressed. The research on appropriate blood pressure targets for older adults has produced specific ranges that attempt to balance cardiovascular protection against the real dangers of excessively low pressure. For adults between 65 and 74 years of age, the evidence supports a systolic target range of 130 to 140 as offering the best overall balance of outcomes. For adults between 75 and 84, the appropriate range shifts slightly higher to 135 to 145 systolic, reflecting the greater arterial stiffness and slower baroreceptor response typical of this age group. For adults over 85, or for anyone who would be classified as frail regardless of their specific age, the recommended range moves to 140 to 150 systolic. These are not arbitrary numbers chosen without evidence. They reflect decades of research specifically focused on older cardiovascular physiology and the real-world outcomes of different treatment targets in this population. The diastolic number deserves equal attention and is consistently underemphasized in conversations about blood pressure management. For older adults, the recommended diastolic range is generally 70 to 85. This matters deeply because the bottom number represents the pressure in your arteries during the resting phase between heartbeats. The coronary arteries, which supply blood to the heart muscle itself, fill primarily during this resting interval. If diastolic pressure falls below 60, the heart muscle may not receive adequate blood flow during those resting moments between beats. This creates a category of cardiovascular risk that is entirely separate from the stroke risk associated with high systolic pressure. You can have excellent systolic control and still be putting your heart under significant stress if your diastolic pressure has been pushed too low. Both numbers matter, and both numbers deserve to be part of any honest conversation about blood pressure management in older adults. What all of this points toward is a principle that medicine increasingly recognizes but has not always practiced with sufficient consistency. Blood pressure management in older adults must be individualized. Two people who are both 78 years old with identical blood pressure readings may require completely different approaches based on their overall health status, their level of physical strength and conditioning, whether they have other chronic conditions affecting their cardiovascular system, how much frailty is present, how well they tolerate their current medications, and whether they are already experiencing symptoms of low pressure episodes in daily life. A treatment decision made purely on the basis of matching a number to a guideline without accounting for all of these individual factors is an incomplete decision that may serve the chart better than it serves the patient. Home monitoring is one of the most empowering tools available to older adults who want to genuinely understand their own blood pressure patterns. Blood pressure is not a static number. It changes throughout the day based on physical activity, emotional stress, meals, hydration levels, quality of sleep the night before, and dozens of other variables. A single reading taken at a clinic visit captures only one brief moment in a picture that shifts constantly. Furthermore, many people experience what is called white coat hypertension, where the simple anxiety of being in a medical environment causes their pressure to read higher than it actually runs in their daily life. Conversely, others may have blood pressure that appears controlled in a clinical setting but spikes at home under normal stress. Neither pattern is visible from a single clinic reading. Home monitoring taken consistently over 2 full weeks, measured both in the morning before eating or taking any medications, and again in the evening, gives you and your doctor a far more accurate and meaningful picture of your true average pressure. It shows how much variation exists throughout the day. It reveals whether your morning pressure differs significantly from your evening pressure. It captures patterns that no single clinic visit could ever detect. When you combine 2 weeks of home readings with the results of your orthostatic test, you arrive at your next medical appointment with genuinely useful data rather than a single number taken under artificial conditions. Certain symptoms deserve immediate reporting to your healthcare provider and should never be normalized or dismissed as simply part of getting older. If you are experiencing dizziness each time you stand up, even brief dizziness that passes within seconds, that is a symptom worth discussing with your doctor. If you notice unusual fatigue in the hours following your blood pressure medication, the timing of that fatigue is medically relevant information. If you have experienced any episodes of sudden confusion, visual changes, or unexpected weakness that resolved on their own, those episodes require evaluation. If you have had any near falls or actual falls in recent months, your blood pressure management needs to be reviewed as part of understanding why those falls are occurring. Your symptoms are not complaints, they are data, and they carry information about what is happening inside your body that numbers alone cannot provide. Staying well hydrated also plays a more significant role in blood pressure stability than most people realize. Dehydration reduces blood volume, and reduced blood volume makes orthostatic blood pressure drops more severe and more likely. Many older adults are chronically mildly dehydrated because the sensation of thirst becomes less reliable with age. You genuinely may not feel thirsty even when your body needs more fluid. Making a conscious effort to drink water consistently through the day rather than waiting until thirst prompts you supports blood volume and helps your cardiovascular system maintain more stable pressure when you change positions. This simple habit, maintained daily, can reduce the severity of positional pressure drops and complement whatever medical management your doctor has recommended. Physical activity, even gentle and moderate activity appropriate for your fitness level, supports the baroreceptor function and cardiovascular responsiveness that aging tends to diminish. Regular walking improves the tone of your blood vessels, supports healthy circulation to your legs, and helps your body adapt more efficiently to the pressure changes that come with movement and position changes. This does not mean strenuous exercise. It means consistent, gentle movement that keeps your cardiovascular system practicing the adaptations it needs to protect you from dangerous pressure drops in daily life. The broader goal in all of this is not to create anxiety about blood pressure management or to encourage anyone to second guess their medical care. The goal is to shift the conversation from passive acceptance of a universal number toward active, informed participation in decisions about your own health. High blood pressure is a genuine cardiovascular risk that deserves treatment and management. That has not changed. What has changed is the understanding that the appropriate target for that management is not identical across all age groups and all individuals. For many older adults, the number that protects you is not the number that looks best on a standard chart. It is the number that keeps your brain supplied, keeps your heart healthy, allows you to stand up safely in the night, and lets you move through your days without the constant silent threat of a fall that could change everything. That is the number worth knowing, worth monitoring, and worth having an honest conversation about with the people responsible for helping you stay well.